What is the best medication for diabetes? Is there the best medication for diabetes as such? What are the criteria for evaluating medication which is most suitable for you? If you or someone you know is living with diabetes, stick around because this information could make a significant difference in your life. Today, we are diving into a topic that affects millions of people worldwide, and that is diabetes medication. Whether you are type 1 or type 2 diabetes, finding the right medication is crucial for effectively controlling your blood sugar level and maintaining overall health. We will explore some of the commonly used diabetes medications available and discussing their benefits, potential side effects, and more. So let's talk about diabetes medication. There are several classes of diabetes medications. Number one is sulfonylureas, and most commonly used medication, the Glyburide, called Micronase, Diabeta. They're available in tablet form, usually taken once or twice daily, half an hour before meals. Same thing with the glipizide, glucotrol, and glimepiride. Amaryl. This sulfonylurea is available in tablet form and is typically taken once a day with breakfast or the first main meal of the day. Let me give you some difference between glipizide and the glyburide. All these three medications, they are sulfur-derived medication. So if you are allergic to sulfur medication, you should not be taking this medication. The one major difference between this medication, which is glyburide, glipizide, and glimepiride, is that glimepiride is not excreted through kidney. So in kidney failure patient or diabetic patient who has a kidney problem, glipizide and glyburide, they should not be used. Your doctor should be very careful because those medications are excreted through kidney, and if kidney function is not doing well, the medications dose may remain in your body for longer and your dose may need to be adjusted accordingly. Other group of medication is called meglitinides, or commonly known as glinides. The most common glinides is, we're going to talk about it, but it stimulates insulin release from pancreas, similar to sulfonylureas, but shorter duration of action. Rapid onset of action, usually controlling postprandial glucose spike. And the most commonly used medication in that group is called Prandin. It's called Ripaglinide, and it is available in tablet form and is typically taken before each meal, usually 2 to 4 times a day. And other medication in that group is called Netiglinide, Starlix, usually 2 to 3 times a day. Before I move into the next variety of medication, let's talk about Prandin and Starlix. So there are patients, diabetes type 2 patient, where postprandial blood glucose is high. Means after they eat their meals, the spike in blood sugar, and the spike prolongs quite a bit. And so they have post-meal hyperglycemia. And this medication can be taken before meal to control that post-meal surge of blood sugar. I'm sure some of you know that post-meal surge is also controlled by taking Humalog or Novolog just before meal. So this is a tablet form of controlling postprandial surge. Usually we try to control with the medication first, but if medication do not work, then we go to short-acting pre-meal Humalog or Novolog. Other group of medication is called TZD, thiazolidinediones. They improve insulin sensitivity in muscles and your fatty tissue. They are effective in lowering blood sugar level, and they also can improve your lipid profile. Common side effect is weight gain, fluid retention, and increased risk of fracture and potential cardiovascular risk. And medication is pioglitazone Actos, which is available in tablet form and is typically taken once a day with or without food. It may be used alone or in combination with other diabetes medication. Other medication in this group is rosiglitazone called Avandia, which is not available in the market anymore. Used to be taken once or twice a day with or without food. But this medicine is still available in other countries, but not in USA. And because of the risk of cardiovascular mortality. And this medication, they work by improving insulin sensitivity in muscles and adipose tissue, thereby helping to lower blood sugar levels in individuals with type 2 diabetes. We're going to talk about the other group of medication. It's called dipeptidyl peptidase 4 inhibitor. Common name is DPP4 inhibitors. Mechanism of action, it increases insulin release and decreases glucagon secretion in a glucose glucose dependent manner. They work by blocking the enzyme called DPP4, which increases the level of incretin hormones such as glucagon like peptide 1, GLP-1, and glucose dependent insulinotropic polypeptide called GIP. And this leads to increased insulin secretion and decreased glucagon secretion, resulting in lower blood sugar levels in individuals with type 2 diabetes. These medications are generally very well tolerated and have a low risk of hypoglycemia, which is low blood sugar. Benefits: it's well tolerated, a low risk for hypoglycemia, and it's weight neutral. It does not lead to weight loss or weight gain. In this group, common name is Januvia. Sitagliptin is available in tablet form and typically taken once a day with or without food, and it may be used alone or maybe in combination with other diabetes medication. Other medication in this group is called saxagliptin, Onglyza. Other one is Trajenta, Lingagliptin, Alogliptin, other name is Nesina, is also available in tablet form and is typically taken once daily with and without food. It may be used alone or in combination with other oral diabetes medication or injectables. Now, the common group is called biguanides, in that you have a metformin. It's a very commonly used medication and it is known to reduce insulin resistance, increases insulin sensitivity. It acts through the gastrointestinal system. It comes in a tablet form or capsule form, 500 milligram, 1000 milligram, 750 milligram, 850 milligram. It's got to be taken with the food once a day, twice a day, 3 times a day, but with the food. Common side effect is nausea, stomach upset, diarrhea, but usually in 2-3 weeks all those symptoms disappear and patient is able to tolerate that medication very well. Next group of medication is called GLP receptor agonist. Commonly used medication: Victoza, Diabeta, Trulicity, Bidurian, Ozempic. Then other one is Saxenada. SGLT2 inhibitors. Common names under this category is Invokana, Farxiga, Jardiance, Stegaltro, Zynquista. Zynquista particularly is a dual SGLT1 and SGLT2 inhibitors. What is the best medication for diabetes? Is there the best medication for diabetes as such? What are the criteria for evaluating medication which is most suitable for you? It's quite individualized, and what is good for one person may not be good for other, depending on what are the risk factor that person is having. Number one is that we are looking at the glycemic control, safety profile, weight effects, convenience, cardiovascular and renal effect, cost, individualized treatment, blood sugar control. Let's talk about that. One of the primary goals of diabetes treatment is to achieve and maintain a target blood sugar level for anybody. So medication should effectively lower your blood sugar to a level without causing a risk of hypoglycemia. The blood sugar got to be well controlled. It cannot be low leading to hypoglycemic symptoms. It cannot be high or poorly controlled and having symptoms of hyperglycemia. Your hemoglobin A1C reduction, which your doctor checks every 3-4 months. Hemoglobin A1C is a measure of average blood sugar level in past 3 to 4 months, under 20 days, and is a key indicator of long-term glycemic control. So effective medication should lead to reductions in A1C levels to reach your target goal set by your healthcare provider. Now, what is the goal? What is the target goal of A1C? Ideal goal is 6.5 to 7. That's excellent control. But the good control, people say 7 to 8 is good control. And so it totally depends upon who is able to achieve this goal. So you have to work with your doctors, and the ideal goal should be close to 7. The closer you go to 6.4, there's a chance of hypoglycemia. And so you have to be careful how ideal number you're looking for. I'm happy with my patients A1C somewhere between 6.5 to 7. The moment they start inching closer to 6.4, I have to start making adjustment in medication, maybe lowering a dose of some medication, or that could be also a good sign that patient is doing everything good per book, has gone through and following through all lifestyle modifications, and this may be indication that there may be a reversal of diabetes if that's what patient is working with his provider. Safety profile of any medication is important because every medication has side effects. As a doctor, we evaluate, the safety profile of any medication. We consider the risk of adverse effect, like hypoglycemia is number one, weight gain, gastrointestinal issues, cardiovascular events, and potential side effects. So medication safety profile should be carefully assessed, especially in patients with comorbidities or specific risk factors. So let me give you an example. If diabetic patients have kidney problem, I would not prescribe metformin, and I'll be very careful in prescribing glipizide or glyburide as well, because metformin can cause lactic acidosis in patients' renal function is moderately impaired. And again, glipizide and glyburide, because they are excreted to the kidney and impaired renal function, makes their blood level unreliable and can cause hypoglycemia. So in that situation, glimepiride would be a better option. Suppose somebody has history of heart failure. I'm not going to prescribe a medication which is going to cause water retention and weight gain. Or I'm not going to prescribe certain medication which increases the risk of cardiovascular morbidity. But I will prescribe the medication which have been shown to reduce the cardiovascular morbidity and mortality in diabetic patients if used. There are those medications. There are certain medications, like many diabetic medication, can influence body weight, either by promoting weight loss or causing weight gain. Depending on individuals' patient characteristics, such as BMI and weight management goals, healthcare providers have to prioritize certain medication. So let's take an example. If the patient is overweight, I am not going to prescribe the medication which have known to cause weight gain. But on the other hand, I have a patient whose BMI is normal or below normal, skinny guy, type 2 diabetes patient. In that patient, prescribing medication which potential weight gain is not an issue. So healthcare providers may prioritize medication that offer weight neutral or weight reducing effects. Convenience and adherence. The dosing frequency and the administration route and ease of use of medications can significantly impact patients' adherence, compliance. Medications with simpler dosing regimen, like once a week injection and fewer administration requirements, they may improve treatment compliance and long-term outcomes. Doctor prescribes you medications and you have to inject yourself 4 times a day. It's lots of inconvenience. Lots of patients, they don't comply with advice and their diabetes remains totally unchecked. Sometimes they even stop taking the medicine. Patients get frustrated. Some people are on 2, 3, 4 different medications. So less the frequency you have to take, better it is in terms of compliance. How many patients on 3, 4 medications? So if you have 4 medication, one you're taking 2 times a day, other you're taking 3 times a day, other one you're taking once a day, it just adds up. It becomes quite challenging. And if the patients are non-compliant and have a tendency of non-compliance and they're elderly, it also carries a risk of, mixing up of medication and potential problems. I touched on these cardiovascular and renal effects earlier, but diabetes is often associated with increased risk of cardiovascular disease and kidney complication. So depending on what's going on with the patient, does the patient have cardiovascular problem or has kidney problem? So your doctor has to evaluate the medication and weigh the benefits and risk and then come with a decision what medication is gonna be better for you on top of glycemic control. Cost and accessibility. I may provide the best medicine out there, but if the insurance is not going to cover it, then there's a problem. Insurance coverage is a big problem. Even the insurance covers patient medication, but the copay sometimes can be so high that it can be prohibitive. Patient would not take them. Lots of senior patients, they are on Social Security, and for them to come up with $50 extra is a huge burden. And some patients would not take those medications. So the cost of medication and their accessibility to patients, including insurance coverage and availability of generic alternative medication, can influence treatment decision for the doctors. Your doctors consider the affordability and accessibility of medication to ensure that patient can access necessary treatment without financial burden. Goal of any diabetes management is highly individualized. There is no one formula which fits all because factors like age, comorbidities. Most of the patients have other comorbidities. The most common one, hypertension, coronary artery disease, heart failure, liver disease, kidney disease. So treatment plan should be tailored to each patient's unique needs. Everybody is unique and their needs are unique, their goals are unique. The doctors would individualize and optimize treatment for better outcomes and quality of life. Commonly used medications and their side effects. It is very important. Many times patients come with a side effect, and sometimes the side effect can be of serious nature. So let's talk about metformin, bigonides. You got to know that it is one of the most commonly used medication for this metabolic disorder all over the world. It lowers blood sugar by decreasing glucose production in liver and improving insulin sensitivity in body cell. Common side effects, gastrointestinal issue like diarrhea, nausea, stomach upset. In rare cases, it may cause lactic acidosis if patient has kidney disease. And lactic acidosis is a serious condition that requires immediate medical attention and admission to the hospital. So if you are taking metformin, got to make sure you don't have kidney disease. Sulfonylureas like Glyburide, Glyburide. These drugs stimulate the pancreas to release more insulin. So they squeeze the pancreas to get more insulin. Thus, they lower blood sugar level. And the side effect of this medication is hypoglycemia, the common side effect, especially if the dose is high and if the patient has any kidney issue. And weight gain and skin rash are also possible because they release insulin. And insulin is an anabolic hormone. It helps body energy to develop into fat. That's what insulin does. It converts blood sugar into a fat, and it also converts fat into liver cells. Fatty liver, in general, fat all over the body. The skin rash is possible if you are allergic to sulfa medication because this is a sulfa-derived medication, sulfa moiety. Next medication is meglitinides. We talked about earlier that just like sulfonylureas, meglitinides stimulates insulin release from the pancreas, and those common medication is brandin and Starlix. Hypoglycemia is a primary concern along with weight gain and gastrointestinal issues. And then you have other group of medication, pioglitazone, rosiglitazone under thiazolidinediones. These drugs improve insulin sensitivity in body cells and decrease glucose production in the liver. And the common side effect includes weight gain and fluid retention, leading to edema and increased risk of heart failure. So again, this medication cannot be used on any patient who has history of congestive heart failure or who has issue with obesity and also has issue with the cardiovascular disease. And this medication has also a risk of fracture. So if you have osteoporosis, this medication should be avoided. DPP-4 inhibitors, sitagliptin and saxagliptin and alogliptin, they work by increasing levels of incretin hormones, which stimulate insulin release and decrease glucagon secretion. And the side effect of this medication is upper respiratory tract infection and headache, gastrointestinal symptoms like nausea and diarrhea. And there may also be a small risk of pancreatitis, although I've never seen it, but it's quite well documented on the drug side effects. Other group of medication, GLP-1 receptor agonist. We talked about Trulicity and all those medication. These drugs mimic the action of incretin hormones, stimulating insulin release and reducing glucagon secretion. And side effect is nausea, vomiting, diarrhea, and constipation. So both diarrhea and constipation. Some patient may experience injection site reaction or an increased risk of pancreatitis and thyroid disorder. Those medications are Ozempic and Trulicity in that category. And then you have SGLT2 inhibitors, canagliflozin and dapagliflozin, and they work by inhibiting the reabsorption of glucose in the kidney, leading to increased glucose excretion in urine. And because there is more glucose in the urine, there is a side effect of genital yeast infection, UTI, and excessive urination. And that can also lead to dehydration and low blood pressure and increased risk of diabetic ketoacidosis, particularly in type 1 diabetes. We have covered commonly used medication, their side effects, their uses, and what you got to know. What we know now that proper diet and lifestyle modification is the most important first step in taking over control of diabetes, followed by medications. Thank you for watching. If you found this video helpful, make sure to give it a thumbs up and subscribe to our channel for more valuable content. And remember, the information provided here is just for educational purposes. You must speak to your doctor and healthcare provider before taking any action. If you have any questions or topics you'd like us to cover in the future videos, let us know in the comment box. Until next time, take care, stay healthy, bye bye.